Thanks so much for having us. My name is Lauren Clay. I'm going to be presenting on the Disaster Food Security Scale grant with Nadia Koirati today. She is our postdoctoral research associate on the project and has been spearheading our approach. So let's get started first with what is a disaster? So this is the canonical definition of a disaster. And what's really important to note is that a disaster is created when a hazard, whether it's natural or human induced, intersects with the built-in social environment and vulnerability. We don't define something a disaster until it affects the things that we love and care about when talking about disasters, when I'm talking about disasters. Also, it's very important to remember that disasters, by definition, overwhelm the ability to respond. So if you're hearing about a disaster, it means that the local community can't handle it. They're going to need help from elsewhere. The systems are failing. And that holds true for food environments. So we're going to dig into that a bit today. We've talked a lot about food insecurity in the US. I want to make the point that, USDA has done a great job of measuring food insecurity and identifying those groups that have increased risk. And those are the same groups that have increased risk for disaster consequences. They're groups that are, for a variety of structural reasons, live in riskier areas and they fare worse. So we have a compounding disaster effect, food insecurity with other things. Before COVID-19, not a lot of research has been done on food insecurity following disasters. So I'm going to summarize it all for you in this slide. So when looking at families who were displaced, so their homes were damaged, were not safe to live in during Hurricane Katrina, at about 2 years post-event, so around 2007, 30% of the families in this cohort were reporting not having enough money for food their family needed. This same cohort was followed at 3.5 years and at 5 years post-Katrina. Food insecurity stayed high, 21% and 23% respectively. By comparison, in Louisiana, the mean food insecurity rate was about 11% during these years. And in Mississippi, higher, 17%, but not this high. The next time that this was really examined was looking at Hurricane Harvey. And two different studies. The first was a proportional sample. So individuals were recruited to mirror the characteristics of people in the state. And they were sampled from urban and rural households. So there was an oversample of rural communities to ensure good numbers. And the surveys were done 12 to 15 months post-event. And in this survey, 42% of households screened as at risk for food insecurity. So this is using the hunger vital signs. A second study looked at only displaced households and collected data much sooner, so 1 month post-event. Same measure, the hunger vital signs, a 2-item screener, found that 54% of households were at risk for food insecurity. So we see food insecurity rates are higher after disasters, and that increase lasts a long time. I've also had the opportunity to do some in-depth study of how food environments are disrupted in disasters. The photos presented here are from Hurricane Florence. And I've found that the food environment has several types of disruptions to availability, acceptability, and accessibility. So we see disruptions to supply. You can see the top two photos. This is a local bread storage facility and the bread aisle of a local store. So the bread storage facility was damaged. It was very difficult to keep bread on the shelves at a time when many households are without electricity. So think no refrigeration, maybe their home was damaged, they have no food preparation or storage facilities. So, a peanut butter and jelly sandwich would sure make ends meet for a while. And that just wasn't possible. We also see disruptions to demand. During a disaster, if you're affected, you might need very different types of groceries. As I mentioned, you might not have food storage and preparation facilities. So what you're buying might look really different. And even if you're not affected, maybe you're you've got family or friends staying with you, you're trying to help out, and you could be buying different quantities of things, shopping at different stores if stores are closed. So certainly disruptions on the demand side. Probably sounds really similar to what all of us have dealt with during COVID. It mirrors other types of hazards exactly. We also see that availability really differs by store type. The two middle photos are the milk aisle at two different stores taken on the same day. The left picture is a big box store where they sell groceries as well as other household items. And the photo on the right is a local grocery store that sells groceries only. Same day. Finally, there's certainly a lack of acceptable foods that are just inappropriate for households. If you have no kitchen or you're sort of on the move, if you're working quickly to muck out a house before mold sets in, you're not really in a position to go buy fresh ingredients to prepare a meal. You really need prepared foods, ready to eat foods, ready to heat foods to meet your needs. Just to illustrate some of these experiences from people who have been interviewed after a hurricane, the top quote is really getting at food availability. This person describes going to 3 different stores and what availability looked like. So if you're trying to navigate a post-disaster setting and you have to go to 3 different grocery stores to figure out your grocery needs, that's a problem. And the bottom quote really gets at the appropriateness of foods. This person was interviewed, sharing that it took them 4 hours to find dinner on the same day that the photo on the right of the produce section was taken, just showing that what's available in the stores, not always a match for what people need in a post-disaster setting. So I just want to highlight some of the gaps that are in the research literature related to food insecurity measurement and surveillance from a disaster perspective. So certainly the USDA, 25 years of measuring food insecurity, thank you so much. The items, all of the various iterations from the 18 item to the 2 item hunger vital signs, they really focus heavily on financial aspects. This limits our understanding of the causes of food insecurity to pecuniary drivers, and therefore limits interventions to those that address monetary barriers. In a disaster, there are so many barriers that are not monetary related, that it's really important that we expand this to understand a disaster context. We're missing the accessibility, acceptability, and availability pieces that I mentioned. And for accessibility, we have great financial accessibility, but less on the physical accessibility. If your road's flooded, your vehicle's damaged, how are you getting food? We also don't do a great job of addressing worry. So we do, in some of these measures that are used, worry about food running out is asked, but I think this is capturing worry of different things, especially in a disaster when there's a high level of uncertainty. And then finally, the recall periods that have been validated, 30 days or 1 year, are not always useful in a disaster context where we have pre-event data that is non-existent usually because disasters are unpredictable, and we don't have really great surveillance related to disasters and food systems. So our disaster food security scale aims to address some of these things, and I'm going to hand it over to Nadia, who will take us through our progress so far. We're presenting preliminary findings. We're still working hard.
Thanks, Dr. Clay. So there are a constellation of techniques, right, that are required in scale development and evaluation. We are taking a 3-phase multi-step approach. The first phase consists of generating those aspects of food security that are affected during disasters or public health emergencies, then identifying the proxies or direct indicators of these aspects or domains. The second phase includes designing a questionnaire based on the domains and items from phase 1, pilot surveys, cognitive testings with target population, full survey implementation, and analysis of newly collected data, including identifying exactly which questions to keep in the scale and which questions serve no purpose. The third phase, is the evaluation of the final scale obtained from phase 2. So this is when we will be looking at reliability and validity of the scale and its dimensions across time, people, type of disasters, etc. Now, our project is still a work in progress. We are about 2/3 of the way through phase 1 of generating domains of food security during disasters and identifying the relevant items for each domain. We used a mixed methods approach in this phase with 3 steps that feed onto each other, as illustrated in the gear diagram here. In the first step, we gathered a group of experts, researchers, and stakeholders. You can see their smiling faces here on the map. This panel was really selected so that we could reach a range of people across geographic areas within the US, different disaster expertise, food assistance stakeholders, and psychometricians. So the group meets monthly for discussions, and through this panel, we have developed a framework of food insecurity during disasters that I will illustrate in a minute. Now, the expert panel was also guided by quantitative factor analysis that we performed on existing data from the National Food Access and COVID-19 research team. So we used the COVID-19 pandemic as a public health emergency example to guide this first phase in the quantitative method. These first 2 steps will be supplemented by the in-depth interviews with a group of people who have experienced food insecurity during COVID-19, during Hurricane Florence in 2018, and during the Moore tornadoes of 2013. These qualitative interviews will begin this month. So together, these 3 steps illustrated will inform the questions to be included in a disaster food security survey. Now, this particular slide looks at the framework that our scientific advisory group developed in a disaster setting. This framework extends both the FAO and USDA definitions and is adapted from the work that some of our panel members have previously published. You can see the reference at the bottom. So our framework identifies 4 main domains: unavailability, which is characterized by food supply failure and food assistance issues; economic inaccessibility; physical inaccessibility; social inaccessibility, which covers the experiences of uncertainty, fear, and worry aspects of food access; unacceptability, which includes quality, safety, food preferences, and dietary needs. Finally, the lack of utilization covers resources and even knowledge that households or individuals need to have to be able to use the food that is available to them during disasters. Now, using this framework, we then looked at the variables that are available from the NFACT surveys. And as you can see summarized on the slide here, we were able to obtain indicators and proxies for each domain and subdomain. So the ones that we identified in our framework all had at least one relevant indicator variable. Although for lack of utilization, we only had one variable from NFACT, so we might have to explore this further. We used 26 of the NFACT variables to perform an MCA. So MCA is a multiple correspondence analysis, which is really the equivalent of an exploratory factor analysis, but with mixed level categorical variables rather than continuous variables. These 26 NFACT variables were found to be an excellent group with adequate correlation between them to perform MCA, as illustrated by our Kaiser-Meyer-Alkin statistic of greater than 0.9. So the MCA produced a multidimensional model in agreement with our current framework that I showed earlier in the slide. The first dimension or domain that was generated was economic inaccessibility. Here, I would really like to draw your attention on the fact that all the USDA food security module questions loaded successfully on this first domain, along with other variables, of course, representing affordability of food during COVID-19. The second dimension relates to fear, uncertainty, and worry associated with the food supply and with food quality and safety concerns. The third domain refers to two different aspects of food insecurity during disasters, namely acceptability of food with respect to quantity and preference, and physical inaccessibility with respect to locations, and in the case of COVID-19 here, having to stand too close to people during the social distancing period. Of course, our study is not without limitations. The data in phase 1 from NFAC was not collected with the idea of developing a disaster food security scale, but we have planned to collect more data. And the data that we do have at the moment through the NFAC will allow, and as I have already presented in the results, do already show a more complete and potentially more objective characterization of food security during disasters. And context specificity is also a strength. We will have information from a range of disasters varying from COVID-19 to hurricanes and tornadoes, as well as across geographic regions varying from New York, Vermont to New Mexico and Arizona. We also used a mixed methods approach, which will allow the contribution of members of the general public to provide information on their food insecurity experiences during disasters. And finally, we have planned an extensive assessment and validation of the dimensions of food insecurity during disasters. As I have, and Dr. Clay has also previously mentioned, we are currently finishing up on phase 1. The next phases will include creating a list of questions for a survey, collecting data and analyzing that data, as well as testing dimensionality, validity, and reliability in phase 3. Over to you, Dr. Clay.
Thank you so much, Nadia. Ooh, I missed a slide. Okay, so I would like to just share in closing the opportunities that we think having a disaster food security scale to use for surveillance and monitoring will provide. You've all seen the news, but also data shows that disasters are increasing in frequency and severity. And so having disaster-specific surveillance tools are critical for monitoring our changing climate and community and population changes over time so that we can adapt. A disaster-specific scale will also provide an important sensor of food system impacts that contribute to household food insecurity. We also think that a disaster food security scale can help to improve equity and emergency response by improving food insecurity among populations that have multiple things working against them, systems, geography, lots of factors. We also would love to improve preparedness with food assistance. So right now in the US, when a disaster is happening, households start preparing. They get supplies, the things they think they might need based on what the impacts are. And we don't have any sort of preparedness food assistance where a household that maybe relies on food assistance can get some additional supplies or some really specific supplies to be ready. Instead, we wait and see what happens in the disaster. And then there's this gap between an event taking place and a decision about a benefit. So I've interviewed countless people over the years talking about disaster SNAP. And so this is a program where your SNAP benefits essentially get reissued if your county is a disaster declared county so that you can replace lost food. There's a gap though, when that determination is being made. And so hearing someone say, you know, I just lost electricity, so all my food spoiled, you know, I was out for a week, but I don't want to use the emergency food because some people are much worse off. So I've scraped together enough for a hot dog today and we'll see what happens tomorrow, is not enough. We also see sort of from looking at COVID, the pandemic, certainly long-term effects, as well as past hurricanes, that one-time benefits or waivers just do not align with actual recovery timelines. So this is a photo here of the SNAP benefit waiver for Hurricane Florence. It allowed the purchase of hot foods and foods that you could, you know, consume on site for 6 weeks. If we're seeing elevated food insecurity rates and you know, recovery rates in the months and years timeline, then you know, 6 weeks is not enough. Finally, I think we can address some utilization challenges through the measure. One example of a utilization challenge is, EBT on an electronic card requires electricity to redeem. So we would love to see the disaster food security scale be used for improved surveillance and monitoring to create other disaster relevant supports for households. Finally, we'd like to acknowledge our research team. So you saw their beautiful faces on the map. Our co-investigator, Stephanie Rogas, who I think is here with us, and Meredith Niles, as well as our science advisory group with a breadth of expertise, have been fantastic. And finally, we would like to acknowledge both the InFact Network, a wealth of data on food access during COVID that's been available to our team, and Tufts and USDA for providing the funding for this work. We're so excited to be doing it.